Good day, members of the IUPAT, and I'm wishing you and all of your families health and safety during these troubling times. The purpose of this town hall is to get you members the guidance on how to be safe during these challenges related to the coronavirus. Now, you're gonna hear a couple of sound bites from our BMSTs who have made the tough decisions to create and protect your health and well-being while on the job. Also, FTI Director Anton Rusing and one of our health and safety experts will participate in a live Q&A on how to best protect yourself while on the job. Now, I want you to know that we're doing everything that we can at the IUPAT to come out of this pandemic stronger than ever. Remember, we are essential, but not immune. We are essential, but not expendable. So participate in this town hall and be safe, each and every one.
All right, brothers and sisters, welcome to another one of our live IUPAT union updates and member Q&A. This is the voice of Yasmin Zara, and I have here with me Anton Rusing, the International Finishing Trades Institute Director, and Jimmy Williams is back with us. He is our General Vice President. So folks, a couple of days ago, we gave you an update on what the response was from Congress and our union, both at the international and district council levels, to this COVID-19 pandemic. For this video, we are focusing primarily on health and safety issues. Guys, we're here to keep it real with you and bring you the true facts and figures in this day and age where the same billionaires own so much of our major news outlets. It can be challenging to get a full understanding of the landscape. And at the IUPAT, we're a union that always puts working class people first before any partisan politics. This is about the safety of our families, our communities, and our very livelihoods. We really have no time for nonsense or any political games. For those tuning in, the second half of this video, it's going to be the same format. It's going to be a member question and answer. So throughout the program, starting right now, submit your district council or local union number along with your questions in the chat box. And even if your question doesn't get selected, as you know, we'll be directly replying to your questions in the comments through the IUPAT account. We'll continue to reply to them even after this live session is over. And the last thing I want to say, and this is really important, folks, we really need you to just take a couple seconds right now to like this video. If you're joining over on Facebook, please go ahead and click that share button so that this video can be visible to even more people. Even if those tuning in aren't in our union, some of this information will be good for everyone to understand. For our last live video, we got about 300 or so total shares. Let's see if we can top that to 500 for this one. Help us reach that goal, brothers and sisters. I think we can do it. All right, I'm gonna toss it over to Jimmy to dive more into it.
Yes, so as Yasmin said, we are here to get the real information to our members. These are trying times for a lot of our folks. And today, we're going to hear from some of our leaders and some of the challenges they've been faced with. There's no doubt that this virus does not know borders, does not know boundaries. All of our members have to be prepared because we are all at risk until there's a cure for this virus. So even though the hardest hit areas of our country right now, as far as numbers and as far as our construction work and man hours, is the Northeast, we want to make sure that everybody across both countries understand that this is a real risk. And we're hoping that today we can give the information that's needed so folks can take the right precautions on the job site. But one of the hardest hit areas of the country for our membership, for our union, has been the big cities of the Northeast, Philadelphia, Boston, New York. We have some messages that we would like to share from our leaders on what they've been going through. And we're going to start with Joe Ashdale, our business manager from District Council 21.
Okay, good afternoon. My name is Joe Ashdale. I'm the business manager of District Council 21. Philadelphia area. We cover eastern Pennsylvania, the state of Delaware, and parts of southern New Jersey. In fact, this pandemic has been having on our members. Initially, in the beginning, there was an awful lot of confusion. The stimulus package came out, there was a lot of confusion regarding that. It was almost an untenable situation. We were some GCs and some contractors and developers were saying everything's fine, we need everybody to come to work. Some members did want to go to work, anxious to get to work. Other members were not so anxious and a little bit concerned about their life didn't matter. But they were in different situations. Some of them have a grandparent living with them, young children, somebody with an immune system. So as this has progressed, it's become extremely clear and apparent that our foremost concern is the safety of our members. We have 3 different governors with 3 different sets of rules, which has been very confusing to us, to our contractors, to the partners in industry with us. But we have muddled through it, and today's April 9th, Thursday, April 9th. We are on top of it. We've implemented all kinds of safety protocols. We do have some projects that are moving along, but they're essential to the health industry, transportation, energy, things like that. But for the most part, all construction is pretty much shut down in the area of DC 21. Right now, we're running, as of today, we're running about 75% unemployment. I suspect that's going to spike after tomorrow. Most construction is going to be terminated in the state of New Jersey. And that's going to, probably 80–85% unemployment. And with that comes, 80–85% less revenue into the union hall and the coffers for the union office, the benefit office, as well as our training programs. We are extremely diligent as jobs in the area. People show up positive for COVID-19, we're shutting down. If that job is not shutting down, we are pulling all membership off of those projects. And I think in the next few days, you're going to see basically a complete shutdown, except for safety projects in DC 21. Like my peers in New York and Boston, we are very, very concerned about safety. However, we did implement all the protocols that we can. We are doing training remotely. We have opted into the employee tax credits for the benefit office, as well as for the union office, and our training program has filed for the loan, and we're doing everything that's afforded to us by law. We're having bi-weekly conference calls with all staff that are spread out over 3 states. We have local building trades meetings, and it's very concerning. It's almost been exasperating for guys like us and our staff to be out there and try to answer questions when not everybody has the answers, not even our professionals. Some of the pieces we did receive from the international have been very helpful on protocols for safety and all that. On a positive note, we've used this opportunity to really get engaged in the community. We have gave out respirators to 4 or 5 different hospitals. We purchased respirators for one of the hospitals in North Philadelphia, one of the poorest communities in our council. We have hosted a blood drive. We have a second blood drive here Tuesday. We're proud that they collected over 100. They collected 104 pints 2 weeks ago. We've reached out to our retirees. Every one of our full-time staff has been in touch, seeing if all their needs are met, if they need water, if they need anything we could do to help them and support them, as well as our membership. We've amended our annuity rules. We've relaxed some of our benefit rules, and we're fielding a lot of phone calls. Our offices have operating on a skeleton crew, and our members are being served. But it is, we have gotten to the point where it was an untenable situation. Do we tell our members, no, you can't go to work, or you got to go to work safely? So, we've said all along, don't go to work if it's unsafe, if you have family members, and that's been our position. Fortunately, we haven't had any very, very serious cases from any member in DC 21, but the curve is still climbing.
So as you can see, brothers and sisters, our union does come together in these times, and we as leaders are being faced with questions like what is essential versus what is not essential. And as our general president said, we're essential as construction workers, but we're not expendable. Joe and other leaders in the Northeast are being faced with the decisions that they have to make on the job sites to protect our members first. And that is our message. Our brothers and sisters up in Boston have been faced with a very similar type of situation, to the point where our leader in Boston, Jeff Sullivan, our business manager, had to make a bold move by announcing that he was going to pull every single member off of every single job site, and to make sure that their health and safety was protected, because the job sites themselves were not safe, and took a very, very strong position. Jeff wanted to send a message to everybody that that wasn't an easy decision, but it was the right decision to make, given the circumstances. And that our membership in Boston will be ready to go back to work as the jobs are safe, and that our members will work on the front lines of things that are essential. And for us as a union, we decided that what was essential was to make sure we're building the medical systems that are needed in this country to deal with the pandemic, and to make sure that critical utilities and that the things to keep our country moving are still moving. But we don't need to be working on job sites that are not safe, that are not providing the critical utilities and the essential medical infrastructure, so that our country can get back moving again. We've also had some really, really sobering news this week, brothers and sisters. We lost 5 members this week to this pandemic. And I think as a union, if we lose one more, just one more member to this pandemic, it's too many. We lost a brother of ours in Florida, Bob Russo, an ex-trainer and a retired member out of District Council 78, Local 1010. DC 9 in New York had to deal with the hard facts and realities that we lost 4 members, 4 brothers this week to the pandemic. We lost a member, Luciana Gomez, who was a metal polisher out of Local Union 8828A. We lost 2 members in our civil service union in New York that work at the New York City Housing Authority, Jose Vasquez Herrera, Fernando Gallego, and we lost a fellow Glazer member out of Local 1087, Travis Graham. That's sobering. That's what this message is about. And if we do lose one more member, then that's one member too many. But what we know is that as a union, we are strong when we're together, and we're the smartest and safest workforce. And the message that we need to send out is that we have to watch each other's back, we have to have the right information, and we have to be ready. We have to be ready for it. We will come back stronger, and we will come back smarter, but right now is the time to take it serious and be safe and watch out for our brothers and sisters. Joe Azapati, our business manager in DC 9, who is right on the front lines of dealing with the pandemic every single day and having to face these hard decisions, would love to send a message out to his brothers and sisters around the country.
Hi, brothers and sisters. I wish you and your families are staying strong, safe, and most importantly, healthy during this pandemic that we're all facing together. These are tough times that we're going through, but I want to reassure everybody that District Council 9 is here for you. For whatever concerns you may have, please reach out to us. We have programs in place to help you and your families, to help get through this pandemic together. We've been through great times, we've been through bad times. Together, we've always strived. We've always come out on top, because that's what we know how to do. And during this pandemic, I promise you, we will come out on top. We will come out stronger than we did going into it, because that's what our members know, and that's what our members believe, and that's what I believe. Through the leadership of this district council and our members acting as one, make no mistake, we will come out on top. I promise you that. I can't wait to see you all. God bless you and your families, and I'll see you soon.
Wait. Yeah, no, wait.
Take that one out of the picture.
So as Joe said, we will be strong and we will come out better for this. And the purpose for this is to make sure that our members know how to work safely on the job sites and understand the real risks that we're faced with as a workforce. And with that, we'll turn it over to Anton to get right into the meat and potatoes of what this presentation's about.
Thanks, Jim. We all know construction is dangerous. It's a dangerous profession. What a lot of people don't understand is it's really impossible to eliminate all the hazards on a job site. It is possible through engineering controls and through administrative controls to mitigate some of the risk, but there's always going to be dangers on a construction site. And that's why we advocate for health and safety training both before members go out to work, as well as continual upgrade training and refresher training. That's one of the reasons that the lack of oversight and mandated health and safety training is one of the reasons why we push back so hard on the IRAP issue. We believe that you have to be safe on the job, regardless of what the hazard may be, whether it's a health hazard, whether it's a safety hazard. Like Jim said, like our business majors you heard from said, like the GP said, and like we all say all the time, our members are the best trained and the most skilled in the industry. And because we focus so much on health and safety, they're also the safest. But with this new hazard comes some need for new practices, new procedures, and different things, different types of training to help mitigate those different types of risks that we're facing. So we know that our members are concerned, and they have a reason to really be concerned. And that's why we focused on developing some COVID-19 training. That's available on the LMS. We have some ICRA training, which is infection control risk assessment training. That's also available on the LMS. We're constantly putting out new things and new classes that will be available. So we have some courses that you can take independently. We also have some instructor-led courses that are available on the LMS. That's also why the FTI engaged industrial hygienist Bernie Missoula. He helped us to ensure that our members are protected. He's helping us go through our health and safety training, so before a member ever steps foot on a job site, we ensure that they're trained and that they're ready to go and that they can work safely. What he also helped us develop once we stepped into this COVID-19 crisis is some job site recommendations, things that contractors can implement so that they can keep workers safe. And it also gives our members a good idea of what they can do or what they can expect their contractors to provide for them, how they can work safely on the job. So we met Bernie when we developed our new PCB awareness training. We were so impressed by his care for workers, his care for the union, and his credentials were pretty good as well. But what really struck us was his passion for the worker. So we brought him as a consultant to help us work through some of our upgrades to our training, some of the new programs that we're developing. He's worked with OSHA, he's worked with the National Institute of Environmental Sciences, he's worked with CPWR to develop curriculum. He's a master's in science and industrial hygiene, and he's got this real long list of credentials that I'm not going to completely go into today, but it is pretty impressive. But like I said, the most impressive thing about Bernie is how much he cares about workers' health and safety, just like we do here at the IUPAT, the FTI, the LMCI, and Finishing First. So I'll turn it over to Bernie. He's going to give us a rundown of where we are today with what we know about COVID-19. He's going to give that to us from a health and safety standpoint, and then he's going to talk to us a little bit about what we can do to stay safe on the job, and then we'll go through some question and answers. So Bernie, I'll turn it over to you.
Hi, everybody. Can you hear me okay?
Yes, we can.
All right. With that, why don't we just get right into it, Kurt, and start off, I guess, with that second slide. All right. So I'm very humbled and honored to be here helping the IUPAT through this. Little photo of myself and a couple of my kids there. I'm the handsome guy on the left, I think. So, where I get my passion for protecting workers, my father, after World War II, was a lifelong union carpenter in local 108 and 122. It switched in Springfield, Massachusetts. So I grew up with discussions around a dinner table of people, getting hurt. There were a couple of fatalities on jobs that my father worked on. So I decided to dedicate a scientific background to helping all of us reduce our risk at work and be able to stay safer and come home to our families, and also not bring anything home to our families, which is going to be a tying theme here for this discussion. So with that said, I've got a couple bullet points up here on the slide. We're going to look at what the science says and what federal guidance says. So one of the things, unfortunately, that we have had happen is that with the slow start that we had out of our federal government, and I'll be blunt, it was slow. There's been some mixed messages about what we should be doing. For instance, they started off saying, well, you should have a social distance of 3 feet. And yet they labeled some groups at the same time needing a social distance of 6 feet. Well, what would make us different as a general public needing 6 feet compared to, say, a police officer that would need 6 feet of social distancing? That didn't make sense. There was also some issue over what was said about what types of masks and respirators different members of the work community should wear compared to what the general public should wear. And that was a mixed message. For instance, they initially said, nobody in the general public should wear face masks. They don't work, but we need them all to make sure that they're available for our medical professionals to protect them. Well, that doesn't make much sense if you're saying that they don't work for the general public, but they're going to work for the medical professionals. Well, which is it? So we're going to get into a little bit of that. Also, who is at greatest risk? We want to cover, what kind of populations, work populations and general public are at greatest risk to succumbing to COVID-19 infection. And then we want to look at transmission controls. And really, we can wrap up this whole discussion here. 2 things. We can identify the hazard. We can look at the risk that the hazard is going to pose to us, no matter if we're at home, on a job site, the different populations that we have. And then we want to identify ways to reduce the risk of transmission. I like to make the adage about firefighters. I've trained a number of firefighters in hazardous materials and radiological response in my career. And one of the things that always amazes me is they run into burning buildings. I would not want to run into a burning building. So what is it about firefighters that allow them to go into a burning building? And they don't always go in. It's training, evaluation of the hazard, and its risk reduction. So they know enough about what causes fires, how fires react. They have the proper training, and they know about hazard controls to reduce the risk if they do have to go in. And sometimes they might have to make the call, look, we can't go into a building that is on fire because it's at too great of risk to us responding. And we could also become the victims. And those are hard decisions to make. So what we want to do, again, we want to give you some information about what COVID-19 is. It's going to help determine what your risk is. And then we want to look at some transmission controls to reduce the risk of you catching it. And ultimately, it's going to give you enough tools to look at your job and say, hey, okay, this might be acceptable for me or it might not. I can't make that decision for you personally, but I can give you all the information I can. And I can also share with you what I would do if I was running, a construction site as an industrial hygienist. Anyway, so with that said, next slide, please. All right, I have this up there. I want to remind everybody that, OSHA has a requirement for employers under the general duty clause to make sure that we are provided with, as workers, a workplace that is free of recognized hazards. And COVID-19 is a recognized hazard. So remember, we always have that general duty clause. And as Jim and Anton said, this is something that's new as far as how we have to respond to it on all kinds of work sites. Not just on the front ends with healthcare, but also on construction sites and everything in between. So it might be a little bit confusing on what laws out there might be applicable and what not, what might not be applicable. But we always have the general duty clause to remember we need to be protected. It's our right as a worker, and it's guaranteed under the OSHA Act. All right, next slide. All right, so current understanding of transmission. Unfortunately, a lot of the modeling or discussion guidelines about transmission of this was folded in from studies and the flu of 1819 and I'm sorry, 1918, 1919, and also some of the more current things in the 2000 era like SARS and MERS. But they weren't complete models, and we're still learning quite a bit about how this is transmitting. So I want to go through some of the current knowledge in the scientific literature right now, and then compare that to what the guidance is saying, and we'll talk about what that means for our risk. So right now we know that it spreads fairly easily from an infected person to a person who's well or not infected, and also from contaminated objects that might have been deposited, say if somebody coughs or sneezes and lands on something that then you touch, and you touch your mucous membranes like your eyes, your nose, or your mouth. If you do get it, it looks like it takes about 2 to 14 days. It's a wide range before you might develop symptoms, if at all. So this is one of the issues and why social distancing and wearing PPE if you are in groups is a fairly good risk reduction technique because you might not know who's going to have it. So symptoms include fever, trouble breathing, cough, tiredness, aches in the body. Sometimes loss of smell and taste has been documented as well. You might not have all those at the same time. In fact, you might not show any of those symptoms. So we've got recent literature from study that shows that up to 50% of infected people may not show symptoms. So imagine then, how are you going to socially distance yourself from somebody who's sick? Because one of the original guidelines from the CDC that was published, it said you stay at least 6 feet away from people if they are coughing and if they're sick. Well, you might not know if they're sick, right? That's what the current literature is telling us. In fact, there's some studies that are coming out around the globe now that are showing that patients admitting to hospitals often present without a fever. And you might have seen, and this might have even occurred on one of your construction sites, they might have been taking, your tympanic temperature, right? A no-touch temperature to see if you've got a fever or not is one of the ways to either allow you on the job to work or send you home. But in one study from the European CDC, it stated that only 35% of people who were presenting to a hospital to administer for COVID-19 didn't have a fever. So it's a pretty high population that's going there to the hospital because they're sick, but they don't have a fever. They have some of the other symptoms, trouble breathing, etc. And there's some conditions that we know that might put you at a higher risk of severe disease. You can refer to some of the other fact sheets that the IUPAT has developed and is available on their website. If you are 60 or older, it seems to be that it's having more difficulty with a severe disease outcome. Now, I'm not saying that some of these risk conditions are going to make that you do not catch it. That's not what we're saying. We're saying that if you do catch it, some of these underlying conditions might give you a harder ride to health. Other conditions are things like asthma, which I have. So I got a prop. I have an inhaler that I have to have. So I'm in one of those higher risk categories. Even though I'm in pretty good shape, sometimes my lungs decide to pull a fast one on me. And if I don't have that inhaler nearby, I have a tough go of things. Also, heart conditions. If you have diabetes, there's a number of other underlying conditions that if you get COVID-19, you are at a higher risk for a disease outcome that could be severe. Okay, next slide. Next slide. Thank you. So this is something that's very important to understand. So how this virus gets transmitted is a key to controlling it, okay? As an example, the Ebola virus that we went through a number of years ago, that was considered to be mainly direct contact transmission. So you had to have body fluid of some kind actually touch somebody's mucous membranes, or indirect contact transmission where that infected Ebola body fluid, say, got on a doorknob, somebody touched that and touched their mucous membranes. Then there's also droplet transmission. So this is where you've got large expelled droplets from somebody coughing or sneezing, right? And those are going to travel a little bit. And you have to be fairly close to somebody to get those droplets on you. They might be inhaled into your lungs, or they're going to contact your mucous membrane somehow, whether they contaminate yourself or your face and you touch your eyes or your nose, your mouth, or it gets on some type of surface where then you've got that cross-contamination as well. That's initially how the CDC is documenting that this is transferring. It's by droplet. That's why we've got the current 6 foot social distancing guideline. However, over the last couple of weeks, there's been a number of studies that have been coming out, and the CDC has also been speaking this, that it appears that COVID-19 can now transfer to people by just talking, right? So that entails smaller particles that can travel farther distances. So that gets into this airborne transmission category. And we've got a number of studies now that are showing that if you cough or sneeze, the projection of the droplets can actually extend up to 8 meters, which is about 24 feet. So one of the studies was looking at up to 27 feet. If you cough, this stuff could be projected and you could get it. We also have studies that if people are talking, coughing, sneezing, etc., it doesn't matter where you are in a room. At some point within a few minutes, everybody in the room is going to have exposure to that projection from the person who coughed or talked or whatever. So it looks like in the literature, this might be something between droplet transmission and airborne. The way I'm looking at it, it seems like air is a fairly light method of transition for stuff, which gives it a little bit higher risk, and it means that we have to take some disease. It's a pandemic. It is increased at a very fast level. So, you know, scientists and researchers are doing their best to try to get as much valid information out. We don't want to put out information that's not going to help or that's not going to be validated. You know, that's why you might see a lot of discussion about some of the potential pharmacological interventions that might help if we get sick. And you'll see, you know, a politician say, "Oh, let's try this. It's going to work. What do you have to lose?" But then we've got doctors that are saying it's not validated. You could lose your life by taking it. So we want to be really careful about what kind of information is getting put out. So there is some good, valid stuff coming out continuously. That's why we're always adjusting and updating the guidance and what you need to know. So right now it looks like, you know, this virus is transmitted somehow between droplet and airborne transmission, but that also includes all those categories below. That's why it's really important to wash your hands all the time. All right, next slide. So this is just a lovely time still capture of somebody sneezing. There are hundreds and hundreds of photos like this from studies that were done. And you know, this stuff can travel very, very fast. So here we got an example of cough or sneezes can reach speeds of up to 33 to 100 feet per second, creating a cloud that can span 23 to 27 feet. That's very fast and very far. In fact, that really helps us determine what kind of effective respiratory protection we need to wear. One current study showed that cloth masks are not useful in necessarily preventing outward projection of this stuff, because there was a study that was done and they looked at the amount of virus that was on the inside of a cloth mask and on the outside of a cloth mask. And what it found was that there was more virus load on the outside of the cloth mask, which is meaning you're sneezing or coughing so hard the stuff is being pushed through with force through that cloth weave and landing on the outside of your mask. That was one study that was done. To me, however, it does have some some validity in what's the usefulness of this stuff, because I have to use some common sense and think that at least if you're wearing the cloth mask, it might be pushing the virus to the outside, but it's at least going to stop or slow down or diminish the travel of this stuff by some amount, thereby adding some protective benefit to the public around me. We just don't know what it is. So there's a lot of unknowns here. That's why you're going to see it's going to be very useful to put together a number of these risk reduction controls to give you your best chance of being protected against the virus. Okay, next slide, please. And this stuff is really very important for you to understand, because it's going to help you make some decisions, what risk you're going to accept. So we know that relative humidity influences evaporation rate of water, which is what our mucus in our cough discharges and sneezes are made up of. So that's also going to affect size of those particles, suspension time, or how long they're going to stay in the air, the velocity and the speed at which they're going to travel, and also the drift distance, so how far this stuff is going to travel once you cough or sneeze. And what we know is that discharge particles lose about 50% of their diameter within a second. So as soon as you sneeze, within a second, half of those particles are going to lose half of their size, which means that it's going to travel farther, it's going to stay suspended in the air longer, can contaminate more of the room, and potentially contaminate more of the people that are in the room. So as relative humidity drops, so if you're in drier environments, this could be outdoors or in a room, particle size is going to get reduced, and that's going to increase suspension, velocity, and how far this stuff is going to travel. Next slide, please. This is a graphic that was adopted from a study that was done for Ebola transmission, but it's very pertinent here because we're talking about the same things. So this is just an example. You know, person A is going to cough or sneeze, maybe talk. They're going to expose person B. And person C, that is standing somewhat farther back distance in that room or area, not exposed yet. Next slide, please. As time goes on, we see that the particles start to distribute more evenly. They start to spread out and they start to fill the area. So they've now covered the person, that's A. They've covered B, and they haven't reached C yet. Next slide. And at some point, if you still stay there, the person who is standing farthest back from person A is going to get some amount of exposure to this. And one of the things we know, exposure to viruses is just like exposure to chemicals, if you will. So if you are working like in the front lines, the nursing staff caring for the patients, the doctors, et cetera, maybe you're working transport, the more virus load or concentration of virus that you are around in that environment, if you get sick, you're going to get sick at a much stronger, faster rate, et cetera. It's going to hit you with a lot more force, if you will. The reason why is because your antibodies don't have time to catch up to that huge viral load that comes into your system. It's just like drinking, right? We can have a couple beers an hour, we're going to be okay. But if we decide to take a six-packs down in 30 minutes, we're going to get drunk faster because our body can't keep up metabolizing that alcohol to make sure that we're not getting drunk. Same thing with viruses. So if you are in a work site or a job that is going to introduce you to being around a lot of people who are sick, your risk is going to go up. And if you're doing construction work, it might be possible that you are in healthcare settings if you're putting up or maintaining risk reduction or infection control barriers like the soft wall barriers. If you're making additions to overflow hospitals, things like that, you might be in a setting, even though you're in construction work, that puts you in that level of risk. So you just have to be cognizant of that and see what kind of work area that you're in for viral load. Okay, next slide, please. All right, so the CDC is defining close contact now as being approximately within 6 feet of a person. So they're saying if you are, out and about, you want to make sure that you're staying at least 6 feet away from somebody. They used to say if they were sick, but now that we know that up to 50% of people can walk around and are infected with it without symptoms, you don't know who's sick. So you want to just stay at least 6 feet away from people. But as some of the slides that I just showed about our current research, it might need to be 12 feet or more. We don't know. In fact, like that one study I showed, up to 27 feet from someone coughing and sneezing. With that said, you want to try to reduce personal contact with people as much as you can. This is a picture on the right here from the Ebola outbreak that occurred. They ceased shaking hands, so smiling, nodding would be enough today, right? Next slide. All right, now I want to just mention COVID-19 survivability outside the body and what we know currently. So it survives differently on different materials. So studies have found that about 8 hours on copper, up to 24 hours. And I'm going to use words like up to because we don't know. It could be less, it could be more by some amount. On cardboard, up to 24 hours. Up to 3 days on stainless steel and plastic. So think about the tools you use. So, if you've got drywall taping equipment that's a mix of stainless steel and plastic, you think about the tools that you use. So if you can evaluate what kinds of materials you have that could be contaminated, you can give an idea of how long a virus might stay on it, and that'll help you put into some controls into place, which could be anything from cleaning and disinfecting your tools to not sharing them. Also, clothing. We have a study that showed that it can survive on the bottoms of shoes for up to 5 days. Really important for not taking this stuff home with you, right? So if you go to a work site, if you're out in public, you come home, if you take off your shoes and the first thing you do is hug your kids or you rub your eyes, you're having a mode of contact there or a pathway of contact where the transmission can occur. So this is important. Also, cell phones. That's something to think about. All right, next slide, please. I see. We're going to try to move along just a little bit quicker here to get through some of this. So if you think you've been exposed or if you are sick, there's guidelines to call your medical provider. This is basically a rehash of what we have on some of the fact sheets that we've already created for the IUPAT, and it's essentially what you can find on the CDC. Next slide, please. Who is at greatest risk? So those who work around infected folks, again, as I mentioned, healthcare, medical facilities, custodians, etc. Just because you're not a doctor or nurse doesn't mean you're in a higher risk work population. Transportation workers, we know, are having an issue with their folks succumbing to COVID-19. Those who come in contact with many people, so grocery store workers, correctional workers, etc. If you go to a large gathering with a lot of people, you don't know who's sick, you're going to be at a higher risk. Underlying health conditions, as we've mentioned, and those who either cannot or will not implement transmission risk controls. So this is an issue where if you're a worker and you cannot implement the transmission risk controls because you go to your work site, they don't have a COVID-19 work plan, they don't have the equipment for you to wear, they don't have adequate wash stations, etc. This is going to increase your risk. And then there's some folks that just won't abide by the guidelines that we have out there. So obviously their risk is going to go up. Next slide, please. So transmission risk control. So I got another prop here. So this is an example of a construction site management plan. This is a plan that the employer should be developing that's going to manage transmission risk on their work site. Doesn't matter if you're a construction site, a bank, whatever business you've got, so that the workers that are coming to work can be protected at a reduced risk as much as possible. It's not going to be no risk, but the goal is to lump as many of these things together as we can to reduce your risk as low as possible, and as low as something that is acceptable to you. Within this plan, basically, you'll find training, worksite social distancing, a worksite sick policy, use of PPE, contamination reduction, cleaning, disinfection, and of course, methods for not taking this stuff home. And I'm just going to touch on a couple of these right now so that we can end this in a timely manner and open up to questions. So next slide, please. There's a copy of the front of that plan. Next slide. Training. Your employer creates a plan, that's great, but you need to get training on that plan because this has to be very specific and very site specific in order to make sure that your risk is kept low. Next plan, please, or next slide. Social distancing and worksite issues. So it's not just on the job that you have to consider about worksite distancing. You're going to commute there and you got to go home, so you have to try to reduce your contact with people. Don't take public transportation. Don't ride share, etc. Drive to work if you can. And depending upon where you work, that might be difficult to do. Some jobs require close proximity. Is there a way that those jobs can either be postponed to later, etc., or is there a way that you can do them with one person? For instance, like a wallboard assisted device that can help you lift. Clocking in and out of job sites, meetings, breaks, anywhere where you can have congregations of folks. This is going to increase risk, so we want to try to diminish that. Different unions or work groups might have different levels of risk reduction methods. That's why it's really important for one work site to have one plan that is effective for everybody on site and that everybody will follow. And with that said, let's take the next slide. Work site COVID-19 sick policy. This is really important. So, the feds created a number of guidelines of this. It's really important that your work site has a work sick policy. If you're sick, don't go to work, etc. This is a photo of somebody checking the temperatures. It's one way to eliminate some people if they've actually got the infection, if they're presenting a fever. But we've already talked about, you might not have a fever and you're sick. So this may be one way to reduce some risk, to identifying some people that might have a fever, but it's not going to catch everybody. So again, that's why we got to lump a lot of these controls together to help reduce our risk. Next slide, please. PPE. So here's the big one. So, your worksite plan should cover PPE. Depending upon what you do for work, you might have to have a different type of ensemble, right? That could consist of anything from respirators to shoe covers, gloves, or eye covering. Next slide, please. Here's the big one. Respirators. So if I was running a site, I'll start off with this. If I was running a construction site, based on what we know about the transmission ability of COVID-19 right now and the presentation of the general public who is sick and what they have for symptoms, I would want everybody to wear N95s on my site at this point right now. One of the problems is I don't even know if every site can get that. But if it was up to me, if I had my resources the way I'd like to have them, everybody that was coming onto the site until this pandemic is coming to a close, disposable N95s. Now, with that said, let's look at the difference between some of these. A bandana, it's not even a bandana, scarves, cloth mask, any of this stuff. We don't know the level of protection that it's going to give. I do believe that it has some amount of preventing the spread, however small it might be. 5% though in my book is better than no percent. But we don't want to give anybody false sense of security that if you put a bandana on, you can go walk around anywhere, go to large gatherings, and you're going to be protected, because that's just not the case. It's not backed up by science. Does it have some benefit? If that's all you have and you've got to run out to the grocery store because you're running low on food, that is better than nothing. Next, we got surgical masks. So these are designed not to protect you. Yeah, you can actually go to the next one. Let's go to the next slide. Surgical masks, actually, go back one more, I'm sorry. So we'll talk about surgical masks in a minute. Those are basically designed to protect the patients, okay? Disposable N95s are designed to protect the wearer of that respirator, and it's designed to filter out 95% of really, really small particles that are down to 0.3 microns in diameter at a 95% efficiency. These have some problems with them because they might not be fit tested, and they're supposed to be. They might not be worn correctly, and they need to be. And the only way that you find out about that is training. The next step up, and many of you might have this, so I might be giving you a refresher on this. You might have a tight-fitting elastomeric half-face respirator that has different kinds of interchangeable cartridges, especially if you're painting, doing drywall sanding, stuff like that. Next level protection will be a full face with interchangeable cartridges. And for, again, talking about the virus, we want HEPA cartridges. But if you're working around other chemicals or other hazards, you're not just protecting against the virus. You have to consider everything you're being protected against. So if you are a painter and you're working with solvents, you need to be protected against, the viral particles out there, but you've also potentially got to be protected against organic solvents or vapors that might be coming from the chemicals that you're using. So you need combo cartridges. That's all got to be outlined in your plan. And then, of course, one of the highest levels we can have is a powered air purifying respirator that you might see a lot of folks on the front line using right now to care for folks with a HEPA cartridge. All right, next slide. These are meant to be single-use disposable. They are not meant to be worn again. And some of the research is showing that the virus can survive on these things up to a number of days after it initially gets deposited. So people are running out of these. We don't have enough. It's unfortunate. So we're getting to extreme measures where some folks on the front line are being asked to save them, at least for a whole shift. There's been talk about how can we disinfect these to be reused again. And unfortunately, there's not a lot of good options because the disinfection methods that they use, whether it's hydrogen peroxide steam cleaning or UV light, actually discharges the material that's made to adhere a lot of these really tiny particles, because it's not just the tight weave that does it. It's an electrostatic charge that helps with that. All right, next slide. This is an example from a surgical mask used in an outbreak in swine flu from Mexico. You can see in the photo, there's a big gap there where their nose is. And you might actually see, if you're just watching some newscasts with some of our news correspondents, they might have an N95 respirator, but they're too big, and you see gaps when they turn their heads where their noses are under their chin. These things have a lot of deficiencies with them. Again, a surgical face mask is designed to protect the person outside of the body, so preventing cough, particles, sneezes, etc., from coming outside of that person wearing it, not to protect the wearer. Again, not the same thing. We don't want to give the impression of this. An N95 is far superior personal protection for your lungs than a surgical mask is. Next slide. There's some issues. Just a quick refresh. If you're going to be wearing a tight-fitting respirator, you've got to get medical clearance on it. Next slide. You got to be fit tested for it. Unfortunately, there's been a relaxing of fit testing guidelines right now, which I won't get into because of the COVID-19 pandemic. But you've got two methods, qualitative or quantitative fit testing. You've got to make sure that just because you're wearing it, that it's fitted properly to your face and that it's going to be efficient in what it's supposed to do. Next slide. User seal checks. Again, this stuff might be a review, but you've got to make sure if you're being asked to put one of these on, that your employer is following an OSHA written respiratory protection program. Next slide. We also need to consider cleaning, storing the PPE, or we're going to throw it out. So again, most of the stuff that we're talking about, the N95s, cloth masks, etc., the gloves, this stuff needs to be thrown out because it's going to be covered, contaminated with an infective material. But if you've got a reusable one, you have to follow the guidelines from the manufacturer, or if the CDC is posting guidelines on how to care for reusable PPE. Next slide, please. If it's not required, the employer may allow you to wear a respirator. There's some things that have to follow the Respiratory Protection Appendix D. They're still going to have to make sure that it's not going to pose a hazard to you as the worker, and they're still going to have a written program covering certain aspects of the Respiratory Protection Program standard. Next slide, please. Contamination reduction. Again, the more that you can keep things at work clean, your hands, your boots, your clothes, tools that you're using, don't share tools. There's a number of methods that are outlined in this COVID work plan that we've got, and also the other tools that were created about different methods to reduce contamination. So clean it and then disinfect it. Don't take stuff home. Don't take stuff to your lunch breaks or breaks, okay? Not one of these things is going to be a magic bullet. You've got to use a number of these things together to reduce your risk to a level that is comfortable for you, okay? Next slide. So we all touch our face all the time. I might have done it a number of times. I can't wait to have my kids watch this video if it's recorded and say, Dad, boy, you touched your face like 20 times. We all do it. This is a behavior that's hard to manage, but that's why it's very important to wash those hands. Okay, next slide. Don't take it home. And then I think we've got our final slide here. When is it going to, how long is it going to happen next? It's going to wave across the country. You've probably seen different states, different cities are saying we're hitting our peak now, we're hitting a national peak. It's all over the place. They're trying to update models as we go. Return to work guidance should be developed by experts and implemented by state and local, at the state and local level. And it's got to be something that the workforce is comfortable with. And employers should have, just like the site management plan, they should have a return to work plan. And with that said, my last slide is a place that I really enjoy going. I think it's my last slide. Next. When I return to normal, I would like to go back to Disney World. And I enjoy it. This is a photo of one that I took last summer when we were there. So it is going to get better at some point, but we can't rush it and we can't force that to happen. We've got to implement as many risk reduction controls as we can, both in the workplace and in the general public, to protect us as workers and to protect our family members. With that said, folks, I hope you got something out of this. I hope I talked clearly enough. I just touched my nose. I realize that. And it's been an honor to hear talking. Thanks, folks.
Thank you very much to Bernie for giving us that really good, informative run through. Folks, you'll be able to replay any part of this video that you might have missed once the live feed is over, just so you know. Before I turn it back over to Anton here, just an update on how we're doing. We have a little over 110 shares on Facebook, and more people are starting to tune in. Our total goal for shares is 500. We're getting there. So if you haven't shared this video already, please go ahead and do so and help us reach our goal. For those who joined more recently, if you have health and safety questions for Bernie, for Jimmy, or for Anton, go ahead and submit it into the chat box now. Be sure to also include your district council or your local union with your question. And folks, you might have seen this already, but in case you don't know, we have launched our COVID-19 hotline for both the United States and Canada. Monday through Friday from 8 a.m. to 5 p.m. You can talk to a live human being, not a robot, a live person will be there to answer your questions, any questions you might have during this time of crisis. Again, any questions at all, right? We got you. Just go ahead and call that line. There's also the pensions assistant line for any pension specific questions that you might have. All right, Anton, take it away.
Thank you, Yasmin. And Bernie, thank you. Everybody, I know that was fast. Bernie had a lot of information to share. We wanted to get it out, but didn't want to keep anybody too long. To get more information like this, you can go log on to the LMS. We have a COVID-19 training course. We have a video recorded of Bernie delivering a very similar presentation to go over a lot of the same information. So definitely check out our LMS. You can access not only that content, but all of our distance learning options. If you go to ifti.edu, there's a link to the LMS there, as well as the videos and the training courses. As the GP said in his video, we're going to come out of this stronger than we were before. We know it's going to be a tough road, but we're going to get through it together. And that's really the union difference. We're stronger together, and because of that, we can set an example for the rest of the workforce. There's strength through unity. We have the best trained, we have the safest workforce in the industry. And during this time, we've really stepped up our distance learning so that we can continue to train and make sure that when we come out of this crisis, we're still the best trained, we're still the safest workforce in the industry. Distance learning is just one of the ways that we're going to come out of this stronger. Through the leadership of the General President and the GB, we're all pulling together, all the departments of the IUPAT, all the funds. We're all there to aid and assist our members and assist our affiliates. We're working there, we're fighting for you. We know that our contractors want to keep you safe. We know your local reps, business managers, trainers, organizers, district council staff, they're all there for you just as we are. We want to share this information. We want to help you in any way that we can. And again, I'd encourage you to go check out the LMS, check out some of the training options. One thing I will mention, as Bernie was going through the respirator components, I realized that a lot of you painters that are out there, you have tons of respirator training. A lot of others of you may not have had respirator training, might not have had fit tests. In the LMS, on the next couple of days, we're going to be posting a respirator training course. It'll be a real short, just a video on how to properly wear a respirator, how to properly wear a dust mask. You won't see me in it because I have a beard, and if I put a dust mask on, if I put a respirator on, it's not going to do much to protect me. So it's one of the things that you need to think about is properly wearing a respirator, properly wearing a dust mask. So check out the LMS. You'll have information on there. With that, let's go to the questions and answers. We'll get into some of those, and then, as Yasmin said earlier, if your question's not answered here, they will be answered at some point and be available, through a frequently asked questions, and we'll get those out. So with that, I'll turn it back over to you.
Great, thanks, Anton. So we got some really good questions here. The first one I want to throw at you guys is around health insurance. We got a couple health insurance questions. The one I'm going to pull is from our brother Marcos Zatina from District Council 16, Local Union 487. He says, my question is, being laid off, my family and I are really worried about our health insurance coverage. Is my health insurance only covering COVID-19 issues while I'm out of work? Any news on unemployment benefits? The max is not a livable wage. Thanks. So two issues that we've been really focusing on. We know it's both on the minds of our members. Jimmy, I think I'll throw this one at you. What do you think?
Yeah, that question is on the tip of the tongue of all of our members that have been unemployed specifically. And, we're going to be running into a countdown, really, where our members could go uninsured anytime that their coverage lapse in a time where they need health insurance more than anything. And so this is kind of a segue into how we're going to keep our membership updated during this process, but there will be another round of federal government relief. We fought hard last time to make sure that no insured member of ours would go uninsured during this pandemic. And what we were fighting for was that anybody who had coverage would not lose it, and that the federal government would subsidize the payments of COBRA into our funds so that our membership wouldn't go uninsured during this pandemic. We did not get it. The federal government could have acted on our behalf and on your behalf, and they didn't. And so we're going back to Washington and we're fighting again. There will be another round of stimulus. There will be another bill that gets passed sometime in the next 2 weeks. And our membership really has to understand that that is going to be the most critical piece of this next stimulus package, and that the government could have acted and they chose not to. We have to be ready to step up and fight again and let our politicians know that none of our members should go uninsured. None of them. The simple fact, though, is that the way our funds work are based on hours worked and money coming into the funds. Money's come into the funds the funds purchase insurance on your behalf. And what we need to know, we need to let our politicians know is, as our work dries up, the money dries up. And it's just that simple. And if they're going to be throwing money around to every single cause, this is the right cause. Put the money into the hands of the workforce and don't let people go uninsured during a health and safety pandemic.
Thanks, Jimmy. So I think these are good for Bernie. We got a couple questions around masks. Dean from District Council 3, we have Marvin from District Council 36, Richard, Drew from District Council 21. Bernie, I'm just going to throw all of them at you so we can get through as many questions as possible, and you can tackle them however makes sense. So Dean asks, I have P100 cartridges for my half mask. Do they provide proper protection? Marvin says, these slides and studies are done with people without masks. Is there a study that shows how do particles travel with masks? And would you recommend everyone on site wear half mask or half face for the entirety of the work shift? Everyone on these projects are given one due to hazards of our work.
All very good questions. P100s, yes. So a P100 means that filter is 99.97% efficient at filtering those really tiny particles. That's better than 95. So if you have those, P100s are better. They are better for you. So yes, wear those if you've got them. Particle travel. So a lot of the studies were done with people just sneezing, so they weren't wearing a mask at all. Some studies were done with people sneezing and coughing, but more of them are done just on what happens if you're walking around and somebody coughs or sneezes. So we're starting to get a pretty good depiction that this stuff, if you're not wearing some kind of face covering and you sneeze or cough, it could travel up to 27 feet and it's going to disperse in a room. If you're wearing like a bandana or a medical face piece, something like that, it's going to prevent it from going some distance. We just don't know what distance yet. They haven't done study on that. What would I recommend? So if I was the health and safety director on a work site, right now, I would want everybody to wear at least an N95 on site, because there's too much of a chance of somebody being there that is sick that you don't know. And I think based on construction work, there are so many times when you need to have a partner help you do something to safely complete the work. We don't want to be forcing people to do a job on their own when they should have a buddy with them. If you've got an elastomeric half-face respirator with either P or N or R cartridges that are either 95, 99, or 100, wear those. This is up to your local unions to try to bargain for, but what I would do if it was me on a site running it, I would require everybody to wear an N95 right now, based on all the research, all the study that I've seen, and how people are getting affected on the site. And just to sum up on that question, I've heard this from other unions on a call that we were on yesterday, where for sites that are still working, and it's not just construction sites, it's other labor sites as well, they seem to be doing okay when they're working with PPE and the social distancing, but once breaks happen, workers congregate with each other, take breaks together, have lunch together. That's defeating, some of the controls. So you have to try to maintain your controls from when you leave your house, you get to the job, to when you come home. And if that's public transportation, if that's the only way you can get to work, then you got to consider wearing an N95 or something on that public transportation to get to the job as well. Hopefully that helps. Did that answer the questions?
All right, thank you, Bernie.
Of course.
I'm going to throw one more mask-related question here from our brother Richard. Sure. He asks, should the contractors be supplying the masks for everyone? What do you think, Anton?
OSHA requires the contractors to supply them. So if a respirator is required, if a mask is required, any PPE, the contractor is responsible for not only supplying it, but ensuring that you're wearing it properly and that you're medically cleared to wear it. So OSHA requires that contractors should be supplying it.
Thank you. Pretty straightforward there. All right, Bernie, I got more questions for you. Ray Casper from DC 57, he asks, I'm working at a power plant. They check your temperature every morning, which means nothing if you've never had a fever. Also, it's almost impossible to be 6 feet apart because you can't hear with earplugs in. Oh, and there's no hand sanitizer for us either. How is this considered safe? Jimmy, maybe you might want to jump in there too, around what they can do, because it's obviously an unsafe situation.
And let Bernie answer first.
Yep.
Yeah, so what I would consider, if you're put in a spot where you can't have social distancing, and from what I've seen on the news from many work sites, it's almost impossible to maintain the 6 feet. And as the studies have shown, 6 feet might be enough. You need to wear an N95 respirator. And is it a safe site? I would answer the question like this. It seems to be a site with a lot of risks to infection. It seemed like they haven't done a good job in reducing your risks to a low level that you can accept as a worker. That's the way I would put it. You need the hand sanitizer, you need wash stations, you got to be able to social distance, and you've got to have respiratory protection.
Jimmy.
And I'll go a step further. We all know how we want to work and how we used to be able to work without this fear or without this risk. And now's the time that we all have to take a real pause in how we've gone about doing our normal day-to-days, because we're now putting each other at risk and you're putting yourselves at risk. And the best guidance that we can give is that you stop and you call your business agent immediately. If you can't get your business agent, call that 1-800 number, the toll-free numbers here at the IU. We cannot lose another brother or sister to this crisis. It's too important. And we are all construction workers. We're all tradesmen and women, and we're proud of what we do. And we all have put ourselves in risky situations before this virus, but this is not something to mess around with. Your employers have to provide you a safe workplace. The union will fight like hell to make sure you have that. Do not put yourself at risk. The general contractors have to supply a safe workplace. Do not put yourself at risk. Stop, step away, pick up the phone, and call.
Absolutely, well said.
Yeah, I just wanted to
I'm gonna-
piggyback on. Oh, I just wanted to piggyback quick on something Jimmy said. It's very imperative to understand this isn't like other health and safety site hazards where what you do can affect your neighbor, it can affect your coworker, it can affect your family. It's very unique that way. So we do have to be cognizant. It's just not, oh, I'm going to accept this on myself. It doesn't matter. It might matter to everybody around you. So Jim made a very good point with that. We are really all in this together.
Great. So we have another question from Ernie, Local 12, District Council 16. He asks, is there a rule that states how many tradesmen can work in a 1,200 square feet room? I think this is another good one for Bernie.
No, the only occupancy that I know of, it has to deal with local fire codes, right? As far as COVID-19 related, no, there's not a rule. So guidelines are not enforceable. CDC publishes guidelines, right? Those are typically not enforceable. OSHA creates standards and rules. Those are. And OSHA saying follow CDC guidelines. Well, if you're putting a handful of people or a bunch of people in a certain square footage, if they're not at least 6 feet apart, you're violating the guideline. So the employer has to be able to do that math, do that prediction, and see if they're meeting the guideline at minimum. And again, the guideline is a minimum. That 6 feet is a minimum. So no, there's no actual rule like that. Good question.
Great. So here's one from Brent Goebel from DC 5. He asks, does the IUPAT support Medicare for all single payer national insurance so that workers never have to depend upon their employment to have health insurance? Workers in all industrialized nations other than ours have not lost insurance covers like workers in the US. This is a really good question. Jimmy, I'm going to toss this one to you.
Sure. Yeah, the IUPAT supports bold action at this time period because it's an unprecedented time period. Right now, as a country, we're going to have to deal with things we've never had to deal with before. This week alone, another 6.5 million people that got unemployed. Last week before, 6.5 million. Within 2-week period of time, we've gone over 10% unemployment. Now's the time that we have to really take a look at the way we operate as a government, the way we operate as an economy. The general president has put together a work group just this week to deal with that very issue of how we are advocating, what our positions are related to healthcare, because it's the next crisis that we're going to be faced with. We're faced with an economic crisis right now where our jobs are shut down and our members are losing their work hours, which means they're going to lose their health insurance at some point in time. We're also faced with the fact that medical costs are going to even skyrocket even more. They're already too expensive. So something has to be done in this country, whether it's Medicare for all, a public option, putting caps on what the providers charge our funds. We're headed down a very, very dangerous path as a country right now, and our union's going to react the right way. And I have no doubt that we'll put together the best position to advocate. But again, this is why we need strong political action at the local level, regardless of party. We have to fight for the things that matter to us. And health insurance is just one of the most important things to being a working union member. It's why we do it, and we have to make sure we protect it.
Thank you, Jimmy. So these are the last two questions. I'm just going to combine them into one. Sean from DC1M, Local Union 357, he asks, can any employer force you to work on an essential job site even though it puts your loved ones in danger? Juan Carlos from District Council 78, Local Union 1010, those who are sick need to stay home. If they don't and refuse to go home, what can members do? Can they call their steward? It's a good organizing question. Jimmy, I guess I'll throw this one to you too, and Anton, you can jump in too.
I mean, I think it's pretty straightforward. In this time, your employers can't force you to do anything if it's not safe. Should you go to work if your job is deemed essential and you feel safe? Absolutely. And hopefully the information that was provided today can help you make that assessment much better as well as an individual. But no employer can force anybody to go to work in any unsafe conditions. It's their responsibility to make sure the job sites are safe. It's the union's responsibility to support you as a member, and we will. And I believe the statement made by our brother out of Florida says it all. If you are feeling sick as a member, don't just go to work to make that paycheck, because you could be putting your brothers and sisters that you work next to at risk by going to work on that job site. That one's pretty straightforward. We have to protect one another. Stay home, stay safe. If you're feeling sick, you got to take every necessary precaution. We lost 5 members this week. We can't lose another one.
Can I add to that?
Jim, I think you're 100% right. I would
Go ahead.
I would never go on a job site if I didn't feel safe. Including working in an office. Here at the National Training Center, over at the IU building, we've taken a lot of precautions to keep our employees safe, keep people that are here safe. I would never work on a job site if I didn't feel safe, and you should absolutely call your union. Call your steward, call your reps, and while you're at home, if you're not working in the evening, get on the LMS, learn as much as you can about COVID-19, learn as much as you can about how to protect yourself. Check out those that work plan, the job site recommendations. Check that out, make yourself aware of what you can do to be safe, and don't put your family, and don't put your friends, your coworkers, your union brothers and sisters in harm's way by going to work in an unsafe environment, potentially exposing yourself and others.
Can I add to that?
Go ahead, Bernie.
Yeah, those are some really good points by both Jimmy and Anton. And I'd just like to add, if you are sick, push for a test. You're going to have to be very proactive in doing this because there just are not enough tests around. You're going to have to fight in some cases to get tested. You want to know if you are COVID-19 positive. They might not give you one even with that. But if you've got an underlying health condition, bring that up. Let them know. Some states do have a public health COVID-19 hotline, which you can call. This is also a way to create a paper trail, you know, where if you get tested and, you know, you tell the employer, hey, I was protecting everybody by staying home because I was positive. The other point that I want to make is that, you know, OSHA does give workers the right to refuse hazardous work. Now, this is a tricky gray area because it's not exactly spelled out in any standard. But as we went through a number of risk reduction controls today, if you find that your employer does not have a COVID-19 management plan, they don't have wash facilities, they don't have the right PPE, you're working in groups together. If none of those safety measures are in place, you know, you can bring that up to your local leader and say, hey, you know, I've got a job site here where they don't seem like they're controlling any of the hazards to any level. So this seems like hazardous work, right? So you can actually build a case like that if you've got a site that's not doing that. And again, hopefully the more information is shared with contractors, like how to develop a COVID-19 plan, hopefully that won't be the case. But you've got enough information to evaluate it for yourself at this point, I think. And I'm always here to answer any questions through the IUPAT at your pleasure. So.
Great, brothers and sisters, even during a pandemic, as was said, we don't stop organizing. You know, these are the moments where we really have to lean into our union, reach out, and part of the reason we're all tuning into this video is that we can stay informed for one another. That way we can keep each other safe. To all of our members, thank you for tuning in, and we hope this provided some clarity to any confusion or anxieties you might be grappling with. Many thanks again to Bernie for joining us and hitting us with some really good knowledge. Folks, even after the live feed is over, you can continue to like and share this video so that increases our visibility. Help us reach that 500 share goal over on Facebook. And just so you know, you can also replay this video once the live feed is over in case you missed anything, or if you want to share this video with others on the shop floor. Folks, as you know, we collectively make up the labor movement. There are moments where we cannot be acting, this is the moment where we cannot be acting from a place of fear or hopelessness. You know that when we do that, it's easy for us to think irrationally and make mistakes. This is the time for union solidarity and for us as members of the working class to step up on behalf of humanity for everyone. This also means we have to find ways to remain connected and engaged with one another. So please make sure you're continuing to check our emails and our social media as we continue to crank up the heat on Congress and bring you the real news as to what's happening on the ground. We are sending you our deepest solidarity to you and your family, and try to enjoy Easter weekend if you celebrate it, and we will see you at our next video.